Hello and welcome. We are going to do the elbow treatment today. So the demo's gonna start in the chair. You don't necessarily have to start in a chair, but remember that all of these treatments can be combined or varied and stuff like that. So if you're doing the shoulder, a lot of times shoulder and elbow stuff go together. So in this case, I'm gonna start with him in the chair. So notice how I've got my hand underneath and I'm supporting his elbow. And my thumb is here, so I want to get on the lateral side. But also a consistent thing in all of these treatments is that you begin by rolling the area of injury, but you also want to move it. So notice how I bring my forearm out and I get a little more flexion in his elbow and then roll. So then I come out, want to get back here, tricep, come around, and then I'm gonna slide down so that I can get the medial side. So just be sure that your client's arm feels supported. See, I'm kind of holding his hand like I'm shaking hands, or I could hold his wrist like that. But I really feel most supported with my hand like that. So my hand is on the medial side. Now I can really get this with movement in the joint. Bicep. All right. So now I'm going to come in and I'm going to gnaw the arm. So again, I can use all 5 fingers in this case and see how he's gently rocking, so that's good. So I'll get one hand, and then if this hand gets tired, I just support the arm with that hand and then switch to the other hand, so I can usually get a different area. So really just coming in and getting the whole area. And then I'm going to go in and press rub some points. So I'm holding large intestine 4, and I'm going to come in, and large intestine 11 is at the end of the elbow crease. So I'll press rub these points. And these are 2 important points that give me the reference for this line and then reference for finding the other 2. So next point is large intestine 12. So I'm going to come up a stone and a half and go a little bit posterior. I'm going to be on the supracondylar ridge of the humerus. And then jump up. So now it goes back and then comes forward. So now large intestine 13 is 3 soon above 11. So there's 3 soon. I should probably go a little bit more because he's taller than me. Okay. And then I'll come back to 11. And then I'll do large intestine 10, which is 2 soon below 11. So 1, 2, there's 11. I'm in line with large intestine 4. So it's large intestine 10. And then large intestine 9, 1 soon distal from large intestine 10. And I generally like to go through, hit them a few times, and then I'll start all over again. So I'll just run through those again. Holding 11 and 4, large intestine 11, large intestine 4, going to large intestine 12, large intestine 13, back to 11, large intestine 10, and large intestine 9. All right. And so at this point, we would get your client up onto the table. So now I've got my client lying face up on the table, and I've actually asked him to move over so that there's more space for the arm on the table. And then I'm just going to come in, and I'm just going to do a little bit of rolling. I just got him from off of the chair onto the table. So I want to do something to kind of get him back into that nice relaxed space. And again, I'm going to roll, moving the joint around. So I also want to get the medial side. And the nice thing about on the table, so I'm going to come in, and this is a really nice way to get the triceps. So I'm going to come in and really get back here, and that allows me to come in and get the medial side. They have medial epicondylitis, which is golfer's elbow or little league elbow. So I can come in and get this whole area, and then I'm just going to come back down and get the lateral area. All right, so the next move is a divergent Tui. So diverge is to move away, okay? So I'm going to start, the tools that I like to use are my knuckles. Some people use their fingers. You can use whatever tool you want to use. I don't like using my thumbs. I really like my knuckles. So I'm going to start in the center of the arm. So first we're going to do the extensors or the flexors, either one. It doesn't matter which one you do, but I'm going to, since his hand is already up. A lot of people ask me, you know, can I use a little bit of oil? You could, but if it pulls on the hair, then I would use a little bit of oil, very, very little bit. Or maybe if you have a good deep tissue kind of a cream that's very viscous. So now I'm going to turn. My tools are going to be together. I'm going to shift my weight in. And I want to go in layers. So the first stroke is going to be on the kind of the medium side, and he'll tell me if it's pulling on his hair or anything like that. And each time I'm going to go a little bit heavier or a little bit heavier. My stance is really important, and I'm using my body weight. So I'm going to come, and my arms are straight. I sink down, and then I move out. So I'm going to stop here and just above the wrist. So now we'll go a little bit deeper. Again, you can use your fingers, you could use thumbs. So when we're doing the posterior side of the arm, we need to kind of stay in between the radius and the ulna. When we get on the anterior part, there's a lot more meat. So I don't want to come and do this right on the bone. So I'm going to stay in between the radius and ulna while I'm doing the posterior side. So let's go one more time. Pressure, okay. So look at my body mechanics. My arms are straight. If you try to do this with bent elbows or bent wrists, it's really going to hurt. So you really want straight, and I'm getting the pressure by leaning my weight into it, okay? Now I'm going to do the anterior side. So this is a pretty common thing. See how his arm comes out like that? It's supported past the joint here, so I'm not too concerned about it, but sometimes I have to put my foot into tree pose to support with my knee a little bit. But in this case, and that's why you could even ask him to move a little bit more. See, now it's more supported. So, but sometimes you don't know how to resolve that option, but you do want to have at least below the joint supported. So now I'm going to do the same moves, and I'm going to do it on the anterior side, but I don't have to stay on the same line because there's a lot more muscles and flesh on this side. So now I'm going to turn. I'm going to start in the center and then go out. So for him, I'm stopping here. Occasionally, I will actually go all the way to the palm with the stroke, but I always stop here, the crease of the elbow. So So now I can go out, and I don't have to stay in the same line. These moves on either side are really great for breaking up tight fascia. So then we'll go to the next move. Oh, and that's cha. So now this is ringing. This is a great move, but some people don't like it because it reminds them of childhood tortures. So there is a very way to do this. That is, I grab with one hand, I grab with the other hand quite firmly, and then I rotate, but as soon as the fascia stops, I stop. So I don't go, the burn would be if I went past where the fascia stops. I don't do that. So I come in, squeeze pretty strongly, and then rotate, hold, 1, 2, 3, and then move to another area, squeeze pretty tightly, rotate. Notice he moved further in that direction, 1, 2, 3. And what happens when you release is that there's this wonderful flush of blood into the area. So again, I never do things to people that they don't think is beneficial. So if someone gets really upset about receiving this, just don't do it. But it's really good for breaking up fascia again. All right, so then the next part. All right, so now we're gonna do a straight Tui. So that's to push. So I like using my fingertips for this. My fingers are pretty strong. Some people need to use their knuckles. I've seen some people try with a thumb. It's not really great with a thumb because this is bad body mechanics to go this way because you're relying on your ligaments and tendons to hold the thumb in place. The reason why some students don't like doing it with their fingertips like this is because it pulls the skin away from the nail, and some people don't like that sensation. It doesn't bother me at all. So if you need to vary your tool, you can do that. So I'm gonna take my fingers, again, my fingers are straight, my wrist is straight, my elbow is straight. And here's the thing, I wanna very slowly flex and extend as I do the stroke. So this is, again, one of those tricky moves where you're doing several things at once. So I'm gonna start in, this is the speed that I go at. And I am not going to change pressure. I am going to go right through the elbow crease. Right into the belly of the bicep. And I'm going to stop right here and then come back up. And then see that we got some nice blood flow there. So then, yeah. And now I started in the middle. That one was a little bit more medial. Now I'm going to come out a little bit more lateral. All right. So now we're going to do the same move, but I'm going to move the arm differently. So now I'm going to hold the hand. It's flat here and flat here, so I'm going to cross the wrist, and I'm going to pronate and supinate as I go through and do these strokes. And I'm going to do one more, a little bit more medial. Look at the blood flow that I brought to the area. All right, now we're going to press some points. So I tend to do a press rub, but again, you can do any of the techniques for points. So if someone is more sensitive, you could do the lightest technique, which is finger springing. Also, there's on, which is like a pulse, like press and release, press and release. So I am going to do a press rub and talk about, just go over the points a little bit. So large intestine 11 is at the lateral end of the crease of the elbow. And large intestine 10 is too soon below that. And then I'm going to come over to lung 5, which is on the lateral side of the biceps brachii tendon. And then I'm going to go to pericardium 3, which is on the medial side of the biceps brachii tendon. And then way medial, I'm going to come in and get heart 3, which is on the medial condyle of the humerus. The next 2 points are hard to see. I'm going to pick his arm up to show you where they are, but usually when I do the points, the arm is on the table like this, and I get them this way. So large triple warmer 10, you go to the olecranon process here, and then you slide up to the hollow right there. So it's right there. So here's the olecranon process. The point is right there. And then small intestine 8, this is going to be tricky. So small intestine 8, here's the olecranon process, and here's the medial condyle of the humerus. The point is right in between the olecranon process and the medial condyle. So this is small intestine 8, and that is triple heater 10. They're very close together. They're both in a really deep hollow, and the difference is that you go triple heater 10, you go straight up to the hollow. Small intestine 8, you find the medial condyle, and there's a very deep valley right here. So when I do it, this is what it looks like: triple heater 10, and then small intestine 8. Okay, so I'll just run through those again, because when I do a treatment, I do the points and I do them several times. So large intestine 11, large intestine 10, lung 5, pericardium 3, heart 3, and then triple heater 10, and then small intestine 8. And after I've pressed those points, I'm going to go ahead and roll and make nice. All right, so now that we've done the points, this next move is totally optional. It's a pluck, which is very great at breaking up stagnation around tendons, but it's very aggressive. Some people love it and other people don't like it at all. So I'm just gonna shop around in this area, feeling for something that's tight. So I'm gonna come in and notice how I'm rotating his arm. So I'm going to come in, here it is right here. So I'm going to pin it down and then pluck it. See that? Usually, he's on a keyboard a lot, so this is a part of his hand. Usually you find the plucking to be right in this area, which is not the case. There's a little pluck right there. But he needs it all the way back here. See that nice pluck? And see how thick that is? So he's got inflammation here. It should not be like that. Well, should or should not, I guess, is irrelevant. This is definitely telling me this is where the inflammation is. So I can come in really get that guy. All right, now that we've been mean, let's go back to being nice. So I'm going to roll, especially what I was plucking. So again, the steps don't have to be exactly in the same order, but usually, generally what I do is I start out nice, I ease my way into the more aggressive moves, then when I'm done with the aggressive moves, then I come in and do something nice again, make nice. All right, so this has been the Tui Na elbow treatment. And I'm sure you'll find it to be very helpful for many of your clients that have elbow issues. Thank you.